October is Mental Health Awareness Month. It's a month where not only do we want to educate and bring awareness to the public, but we also want to destigmatize the issue of people who are living with mental health. SAPS is no exception to that. Today, we're talking about mental health, and we invited in studio Major General Vusisiwe Themba, who is the component head for employee health and wellness within the organization. General, welcome.
Thank you. Thank you, and good afternoon to you.
Maybe let's just start with highlighting why it's important for us to have mental health awareness month, but specifically in the organization.
It is very important for us to really raise awareness to our SAPS employees, especially during this month. It's part of our health calendar activities that we embark on. Because when you look at the nature of policing, it exposes our members to gruesome crime scenes, and they, on a daily basis, encounter the criminals that are also very hostile. And sometimes even the very communities that they serve, they tend to reject them. There's a lot of negative media coverage. So it does have an impact on the way one sees herself or himself, and also in the way they offer services. So it is important for us to raise awareness so that whenever they start experiencing some of the symptoms that are linked to a declining mental health status, then they are able to know where help is or what to do in order to assist themselves or their colleagues.
And when you talk about the nature of the job itself, you've already alluded to the fact that it's very stressful. And of course, there is a lot of traumatic exposure that our members face on a daily basis. What are we doing as an organization to cushion some of these consequences after they come back from the gruesome crime scenes in order for them to deal internally with the issues of mental health?
We do not wait for them to come back. We proactively start by empowering themselves through different programs that we are offering to them as a way of raising their awareness and just empowering them and building their resilience. So we've got different programs, a mental health program that focuses on just highlighting the symptoms and also the treatment related to depression, bipolar, anxiety disorders. We also have a program that is looking at choosing life. It's called the Choose Life program, where we highlight the activity matters related to suicide and also how to manage those symptoms. So we also build members' resilience to say, when we're offering policing, sometimes there's no recovery time for our members. They are forever on the run. So sometimes we just empower them to say, what do you do in a situation where you are on your own and you experience or are exposed to these traumatic events? Then we empower them with some kind of skills and self-help initiatives that they can embark on.
General, you've just alluded to one very key and critical issue, which is the suicide, and you've already spoken about some of the intervention. Every day, not every day, but regularly would hear a member who has decided to take his own life, or sometimes even the family's lives, because of some of the stresses. What are some of the resources that we have internally in the organization to deal with some of these issues to prevent the occurrence of suicide?
As an organization, we adopted a multidisciplinary approach to dealing with suicide. So we've got professionals, that psychologists and registered counselors. We also have social workers, and we also have occupational therapists and nurses and the chaplain, who in an integrated manner will assist an employee who is presenting with suicide symptoms depending on the needs of the employee. So we are, beyond just maybe those counseling, we also offer debriefing interventions. Like I said earlier on, the level of exposure to traumatic events and gruesome crime scenes is quite high. So upon return, maybe after an exposure to a traumatic event, we offer debriefing services. They take a form, we deal with individuals who would like to be debriefed maybe after an individual exposure or after maybe whatever experience one has gone through as an individual. But we also offer group sessions if maybe there's that collective exposure by a group of employees. We also offer debriefing services to families and also aftercare services in cases maybe a member has already committed suicide or there's been an element of exposure to crime or some incidents by the family.
And what are some of the early warning signs? For example, if we are in an operational setting and I have interacted with some of the members and you can pick up some things about your colleagues that you feel are out of character, what are some of the early warning signs and what can you do as a colleague to make a referral about a member that you can see that this person is going through something but maybe they're not sharing?
Okay, most prevalent signs will be a member who is hypervigilant, where you find a person is quite not settled or calm. They present with high levels of anxiety, they are edgy, they sometimes you find they pace up and down. And in some instances, especially when there's an element of anger as well, where you find that a member, sometimes they even find difficulty in expressing themselves when you engage with them because of that anger, the racing thoughts and stuff. And in some instances, we also experience members who withdraw from the usual activities, knowing you as a person who always engages, is smiling and is always happy. But then all of a sudden you realize that you withdraw. You do not enjoy engaging with other people or participating in activities that you would have liked under normal circumstances, or you just want yourself to be alone in secluded spaces. You don't want to go out and mingle and be happy with other people, or even in the workplace. Sometimes whenever there are discussions, you tend to snap up, you fight. There's maybe increased levels of conflict between you, maybe with your intimate partner or in your private space and also in the workplace.
Now, if you bring it closer to our members, let's say there's a constable Machaya somewhere in a police station who is part of the crime prevention unit. They've just come back from a crime scene and you can see that he's struggling emotionally. What is the first thing that the constable can do, and are there resources available at a station level?
The first thing is usually we train the commanders as well to say on the referral process. Whenever there's an exposure, a traumatic incident or encounter with criminals, it is the responsibility of the commander to refer, even if they are not displaying any symptoms, because sometimes other people have got this delayed response. So they might not show any symptoms right at that point, but later it will come up. So the first responsibility lies with the commander to say, once they got a report of an encounter, then they need to keep EHW on standby. Then the members also, you know yourself better than any other person. You don't wait to be referred by any other person. But once you start realizing that your levels of fear and anxiety are high and you are struggling, you find yourself maybe shivering, or sometimes you are extremely angry, so then you need help. So we do not at the current moment have EHW stationed in all the police stations because of the limited resources that we have. So we do have, though, all the numbers and standby services of EHW that are put on different platforms within the stations. Most of our EHW members are stationed at district level, but servicing different stations. So stations are aware of who is the person, even though they are not physically there, but they are on a 24-hour basis reachable through their standby services for them to come in and offer services to our members.
And of course, I will need to ask you this because I want you to reassure the members, because there's this perception or myth that says the levels of secrecy that exist within our interaction with the psychologist sometimes leaves a lot to be desired. But I want you to then just assure them to say all the ethical considerations that exist within psychologists outside are also the same ethical considerations that the psychologists within SAPS abide by, and that whatever you share with them is confidential and can never be used against you, whether it's for promotions or whatever.
One of the key principles that is guiding our service offerings is the key principle of confidentiality. We are saying whatever information that you share with one of our professionals will be kept confidential unless we are forced by law to breach confidentiality if we are subpoenaed or if you are becoming a threat to yourself and to other people. But in all other instances, information is kept confidential. I know currently within SAPS, there are those misperceptions that EHW members are not keeping confidentiality, which is not true, because we are using professionals that are registered with different regulatory bodies and professional bodies like your Health Professions Council. And if there is a case that can be proven to where an EHW practitioner has broken confidentiality, that person can even be struck off the roll. So even internally, our policy as SAPS, we are taking the issue of confidentiality very serious. And the other matter is that if you consulted EHW, it in a way jeopardizes your promotional opportunities, which is not also true, because engaging in EHW activities doesn't have any impact on other HR-related matters. Our files are kept separately in lockable steel cabinets. So we do not really share information with any other person or even our administrative clerks. So whatever is shared with EHW matters is kept confidential. And we have been out there to SAPS members to see if there's any case where confidentiality was in a way compromised, then we are available as management to take up that case up to the level of the registration body of that particular professional. And to date, we've always been saying, preaching the issue of confidentiality. To date, we haven't received a single case that is linked to the problems or challenges with confidentiality.
And in conclusion, General, I know that we only talk about mental health in October because it is Mental Health Awareness Month. But throughout the year, we also need to, I think, do more in terms of the awareness and public education on issues that relate to repeated exposure to trauma and how that can affect our members on the ground. What would be your message to our members in terms of just accessing some of the services of EHW?
The main message to our members is that do not suffer alone, because sometimes members, when they experience some of the symptoms and stuff, they keep to themselves. SAPS made a good decision to employ psychologists, different professionals to really be there for you. So whenever you feel heavy laden and overloaded with work and any other life stresses, do not suffer alone, because help is available and help is kept confidential. So it's only when you give permission for them to can share your information. So it is important to go out and seek help and also participate. EHW is organizing a lot of calendar health events that we do for our members and also for the programs. Currently, the participation is quite low. We would like more members so that they are actively screened before even the symptoms that they are experiencing, before they even get out of hand to becoming disorders. We would like them to come through and be assisted. Thank you.
Chandra, thank you very much for making the time.
Thank you. Thank you very much for the time.
That was General Temba, the component head for EHW, Employee Health and Wellness in the SAPS, talking to us about some of the interventions that we have in the police. After the break, we talked to one member who's operational, but we also talked to a psychologist from the external side, Mr. Sia Zikalala. Don't go away. Welcome back. We are still talking about Mental Health Awareness Month, and we've invited in studio two great guests. We've got our external psychologist, Mr. Sia Zigalala, who is a psychologist in private practice. We also have Constable Nice Masilo, who is an operational member of the South African Police Service with the Rapid Rail Police Unit Cross Border. He's going to share with us some insights about some of the experiences that he's been exposed to. Gentlemen, welcome.
Thank you very much, Brig.
Maybe let's start with you, Constable. Dressed in the gear that you are dressed in, you are an operational member. What are some of the repeated exposure to crime scenes that you have experienced since you started with the organization?
In most cases, within the unit that I am working in, we are exposed to several different kinds of crimes, including whereby you find cable thefts, the damage of the infrastructure within the rapid railway systems, and also those ones who are stealing the transformers and all those the transformers cables, as well as just armed robbers within the railway systems.
And having been exposed to, let's say, some of the shootout with criminals, how do you process that when you get home in terms of what you've experienced during the day and some of the emotional traumas that comes with it when you get home in the evening?
It is not an easy, and it is never easy to actually just immediately cope with everything that we experience when we are on the field of work, because some of the things can be traumatizing. And if they find you weak, you can find yourself not knowing what to do, but committing things that you are not supposed to be committing. So we just try by all means. With me, I try by all means to talk a lot. I talk a lot with the people that I feel closer to, and just to offload onto them everything that I'm experiencing and everything that I'm going through at work, so that the load can become more easier to carry than just keeping quiet and let it sink in me. So yeah.
And Sia, I can see you nodding as he's talking about talking a lot and confiding in people that are close to him. How important is talking when you've had a traumatic experience or exposure to a traumatic experience in terms of just vocalizing that experience?
It's very important to express emotions as opposed to repressing them. What really creates a battle of mental health and a battle of stresses and trauma with people is the inability to express emotions in an effective manner. When you bottle things inside, I always make this example that when you bottle things inside, it's like taking an empty plastic container, like a water bottle or something, and you fill it up and you stuff it up with sand or any other substance. Ultimately, what you will see is that the bottle starts to swell up and you keep on pressing down and pressing down. Ultimately, it explodes. Now, the problem with explosion is that you don't have control on where things spill off to. They will spill off into areas of your life that you never wanted them to be touched. They will spill off on your marriage. They will spill off on your work. They will spill off on social relationships and many other important areas really of your life. But when you express emotions, when you talk about something, as my brother here is explaining, it's very important because it's almost like you decide to intentionally and purposefully say, this bottle is now full, I'm going to empty it. It is a conscious decision that you have to take and make that, okay, I'm going to go into a controlled environment and I'm going to empty that. So speaking about your experiences and your emotions, whether to your partner, whether to a professional, or whether to a friend or so on, it is a very important act of expressing emotions, which serves a great function in emptying and debriefing yourself in the process.
Now, when you talk about some of these experiences, for example, what is alluded to, and from a psychological point of view, when these members have been exposed to a lot of crime scenes, a lot of gruesome crime scenes, chasing criminals, shooting incidents, how would that, psychologically speaking, affect any normal person that you want to talk about?
It presents what we call psychological trauma, or post-traumatic trauma, as perhaps you have been familiar with the term post-traumatic stress disorder, which is now a disorder of a particular exposure and experience to a traumatic event. Now, what he is describing is that basically they work in places that at a consistent rate always put their lives at risk. Because when we talk about trauma, you're talking about a near-death experience. So if I witness someone dying, there is a near-death experience, it can have a traumatic impact on me. If I or myself almost die, whether be it in a car accident or be it in a shooting, or exchange of fire and force, between police and criminals, that places the life of a police officer at risk, meaning it's a near-death experience. In fact, the entire work scope of police is a near-death experience because of the level of violence that they're exposed to, which leads them to, registering all sorts of traumatic experiences. So there's a lot of it. It's actually trauma, what one would be going through. And it's very important then to process that and understand it for what it is, because you cannot just then switch from that environment into a different environment and loving and caring, being a husband at home, immediately just coming from a place where you almost died. You are still in shock. As you walk out of the crime scene, as you go back to the police station, you are in shock. Your mind is telling you that anything could have happened, because the mind works in quite a way that, it triggers these automatic negative thoughts that always come. Some of them are to help us to cope, like your adrenaline, to pump up the adrenaline, the flight, freeze or fight responses, they come in there. So when you are still in that moment, in that shocked moment, you need to then have some form of a breakage of that scene, so that you may be able to then exist in a different context where you are expected to play a different role, either being a friend or being a father or being a colleague to even your co-workers.
Now, as somebody who's dealing with a lot of issues around depression, suicide, anxiety, those kind of issues, what do you normally tell the clients that come to see you? I know you deal with a lot of law enforcement clients. What do you normally tell them in terms of how to cope with the stressful nature of the job?
It is very important to be genuine to what you are feeling inside, to be genuine to the emotions that you are feeling. Often we repress these emotions because they are associated with weakness. They are perceived as maybe a sign of weakness. So we shove them away. But shoving it away doesn't help. It's almost like you are postponing the inevitable, because they will still come and catch up with you until you decide to consciously then confront them and face them. So being genuine to your emotions is very important. Do not try to be strong when you are feeling weak. Do not try to convince yourself that you've got it, even when you can see the early signs that this thing has really affected you. Own up, embrace what you are feeling so that you can be able to deal with. So it's just being genuine to those emotions. So genuineness to emotions, it says, if you feel like crying, you need to cry. The whole ideas, how we were raised and so on, and what has been popularly known in communities that cowboys don't cry, men don't cry. It's the things that really are affecting us, and they are standing in the way of effective expression of emotion. So you need to be genuine with your emotions. If you feel like crying, you need to cry. If you feel like screaming, you need to scream. Some of these experiences, they stir up a lot of anger within a person. So sometimes you would need to allow yourself the space to express that anger in a much more effective way. If you feel like screaming and punching something, it's okay. It's okay. You need to understand that it is okay to feel angry because of the things that you got exposed to in the field. You need to understand it is okay to feel sad and to feel pity, to feel weighed down by whatever experiences that you have faced there. Now, own up to that experience, process it, understand what it means to you, and then you may be able to move forward.
Now, Constable Masilo, you've just come from an operation. I'm sure you're going back again now. Having listened to what the psychologist is saying, and I know you've said you've visited our psychologist internally from an employee health and wellness. What encouraged you to even take that route of going to employee health and wellness within SAPS?
I am somebody who likes to talk and offload. I don't like to bottle up things in most cases. So when I encounter incidents that I feel they are very much heavy for me, I usually prefer to go and offload with the psychologist. I sometimes use, our EHW, Employee Health and Wellness. If not them, I'll go to our the private psychologist. So the incident that once led me to trying to go and see our EHW was that when I was with one of my colleagues the other day, we were doing some night patrols on Ben Schoeman Highway. So in that incident, it was the time that during the July unrest and so forth, before those times of the July unrest. So what happened is that there was a guy who was driving from Durban who bumped us at the back, bumped the van that we were driving at the back. When we got out of our car and tried to go and check on if the member, if that person is okay or not, he came out. I asked him what happened. He said no, he was talking to his wife who was pregnant and he was deployed in Durban for 3 months. So they had some altercations from Heidelberg up until here in Benskoman, next to Samrand. So the guy immediately, just the moment when I went back to my car, to the car that we were utilizing, I and my colleague, I asked him for the license. Then he went to his car. Then when he went to his car, immediately he just came out with the gun and shot himself. So in front of me, I was looking at that incident. So to me, that incident was very traumatic as well, because it is not something that I anticipated at that moment. It is something that just came out of the blue, because I wanted to listen more into what happened and everything like that. So, but yeah, such incident traumatized me a bit, and I was also going through some family problems at the time. So it felt like it is becoming more of a burden to me. Then I decided, no, let me go and talk to one of our psychologists at the very much helpful. Trust me, it was very much helpful. I felt so much at ease after talking to the lady who I was talking to. She helped me a lot.
Do you normally encourage other members? Let's assume the guy that you were with or your colleague who were with you in the car. Do you normally encourage other members to do the same in terms of just approaching EHW to talk about or debrief from the incident?
I do that a lot. I do that. I speak to most of my colleagues, some of them that I know their problems. Yes, I do encourage them to speak to a certain professional who can be able to assist them and be useful in that regard. Because you bottling up things will end up leading you into the route that you are not supposed to be taking, because you get confused and distracted from a lot of things. So your senses are no longer working, all of them, because they are over. Everything is overworking in your body. So you are not thinking straight. So it is best that you find a professional that can be able to assist you and help you to regroup and come back to your normal senses, and so that you can take rightful decisions. Mm-hmm.
Now, Sia, just listening to that story, it's 1 in a million. There's 180,000 of us in the SAPS. And that incident has nothing to do with what was happening then. There must have been other underlying issues, but our members obviously are exposed to even those issues that have got really nothing to do with commission of a crime or the accident that they were trying to, investigate. How do you rationalize with what he's been through and how to process that if the next person was to go through the same?
It's important that we understand what mental health is. When you're talking about mental health, you're not just talking about the absence of a disorder. Just because the person has never been diagnosed with depression, with anxiety, or whatever form or PTSD, it doesn't mean necessarily everybody is healthy or all is well with that person. It's not just the absence of a disorder. It's a continuum that involves a complete well-being of a person, body, mind, and soul. So that is why we use what we call a biopsychosocial support, biopsychosocial approach. In the biopsychosocial approach, we are basically understanding that the stressors and what influences the person's behavior, emotions, and thoughts, it's things that come from their whole rounded life and functioning. Whatever that stresses them from home, it's got an impact into their work. Whatever the stresses them at work, vice versa at home, it would affect various areas of functioning. This guy bumped the car because he was engaged in a stressful argument that emanates from his a marriage or relationship. And that affected even how he was functioning on the road. Remember, when you are on the road, it's an occupation, basically, driving, you understand? Because you actually get trained to do. You get trained and you are exposed to all the rules of the road and so on. So at that moment where there is an external stimulus that is affecting you, or an external stressor emanating from one part of your life, it affected his driving already. He could no longer concentrate and observe the rules of the road at the time. So immediately it makes that person a danger to himself and a danger to others around. You understand? So, and then once that has happened, he is so overwhelmed. This on its own, the fact that now he has bumped another car, adds to the stressor. It still has nothing to do with his occupation or work, but it adds to say everything now. So how they process it, how possibly he was processing it, is that all is bad. Everything is just going wrong and bad. He was not seeing any light in the end of the tunnel. At that moment, he was suffering from severe hopelessness. So it comes from multiple other things, areas of functioning, that when we process it, it's almost like everything gets clapped together and everything just becomes so heavy, at that moment, and you just don't see any way out of it. And hence the only way is to just, maybe resort to suicide at the time. It's because of the lack of hope and the hopelessness that has been driven by that. So in terms of processing it, really, when you consult or you seek professional help, as is saying, or you allow yourself to debrief and talk about things, it allows for an external opinion, an external view of what you're going through. I call it a meta perspective. In fact, in psychology, we call it a meta perspective. So meaning you are rising above the current situation where you exist, because when you are in the problem, you are unable to see other things, including your role in the problem, So, but the moment that you get someone who's objective, who's not emotionally invested into the issues that you're going through, they are able to then help you to actually see even other areas. Where you were seeing darkness, they're able to say, but there's a light if you look there at the end of the tunnel. Have you considered 1 and 2 and 3? They give you a fresh perspective into the things that you are going through, which you were unable to go to synthesize yourself because you were in the problem at that moment.
Yeah. And how can people like Constable Masilo here and many others protect their mental health in terms of the experiences that they're still going to face? Just preventative measures in terms of how do you identify triggers, when do you know the time to seek help, and what interventions are out there available?
The good thing is there's always signs. There's always early signs and symptoms that you can actually see. And when you start to see them, then you realize, okay, perhaps now it is time. So self-awareness is very important. You would see that when you are overly stressed, or the stressor is now becoming clinical, let me start here. There is a difference between what is clinical in terms of mental health issues, what is clinical and what is normal. So I get stressed. You get stressed. Everyone gets stressed on a daily basis. If I didn't get the money I was expecting on that particular month, that can stress me. It can make my mood go low, and I might not be interested in certain things. But soon I bounce back and I go back to normal. So that happens. I lost someone. I feel sad, and then I come back to normal. So where we say it is now pathology or is now no longer normal is when you are unable to bounce back into the norm, into the normal level of functioning, where you get actually trapped into either being into depression or into a stressful way of behavior, or a symptomatic way of behavior. So what you would then see is that perhaps now you are starting to lose a lot of interest in things that previously would have been interesting to you. When your friends or your colleagues say, let's go out, you just don't have the energy nor the interest to do that. Then you'll start to see, previously, you know yourself, this is not how I was. Even with your colleagues, because as colleagues as well, we can help each other. We can be able to identify the problems. You know how a brigadier is all, how he is and on a daily basis. And you can be able to tell that, no, today he's not himself. Why? There's a change in behavior that you are seeing. So you must be able to pay attention to those early signs and symptoms. When you find yourselves wanting to stay more in bed than getting out, where you find yourselves, even maybe your drinking levels have increased. You are now drinking more, taking a lot of alcohol than you previously would. You are now smoking a lot for those who smoke. You are now smoking a lot, than you usually would. You are now spending more time alone and have no interest to associate with other people. You are irritable at times. A small thing, you overreact into situations. You are more worried, you are more anxious, at times than you would see. Then these are the early signs. They are pointing you to say something is not really going right, and perhaps you need to then pay more attention in reflecting and seeing exactly where is this coming from, and then seek the necessary help.
Now, from a bird's eye view, from your side as an external eye, what do you think are some of the things we can do that are low-hanging that we should be doing all year round, not necessarily waiting for Mental Health Awareness Month that comes once a year? Mm-hmm. What else can we do just to talk about this issue and impart this public awareness to our members to say there is help and you don't have to go through it alone?
Of course, prevention is better than cure. At all times, prevention is better than cure. I believe that what you see, a visual exposure, really stimulates learning about something. It's the same thing that the industry, many industries do. When they are advertising a particular product, you will see it everywhere you are driving. You will see it on billboards, you will see it on TV, you open radio, you are hearing about something. If that was to happen when it comes to mental health issues, more people will become far much more aware of what mental health is and what they can do when they are, affected by it. It will also help to destigmatize, mental health, generally, so that it is known that you are not alone when you are having a problem. When you are having a stress, when you are feeling sad or you are feeling suicidal, you are actually not alone. There's many other people who go through that, and there's a lot of help and options for help that are available there. So things like if our police stations would have posters that speak about what is suicide, what is depression, what is mental health, every now and then, which hotlines to call, numbers, that you would call, as it is displayed in this studio. Imagine if you were to have that in every single police station, where, even in the police vehicles inside, there's a particular a little poster, an I5 sticker that is stuck somewhere speaking about issues. You become more visually exposed to it, to the point that at the time of need, it quickly comes back to your mind, because a learning process happened without you even realizing that you were actually learning about it because of that repeated exposure to it.
And just in wrapping the discussion, Constable, I just want to check from your side, how do you manage the work-life balance? Because it's important that you have the life at work, but you also have the life at home. You alluded to the fact that at some point you're also having some personal problems. That's why, or one of the reasons you went to see. But how do we balance to make sure that what has caused you emotional trauma at work doesn't translate to emotional trauma at home?
It's a bit heavy, but it can be made simple. By so saying, I'm trying to say it can be made simple through talking, as I've mentioned before. It is important that whenever you feel that there is a matter or there is an issue that you have experienced at work, and it is becoming so much heavy for you to deal with, or you feel that it's going to be a problem when you get home, just try by all means that before you reach your household, or before you reach home, you have spoken to somebody else that you can rely on, somebody that you can trust, because it is not easy that you talk to everybody. There are people that when you talk to, they tend to turn your matter into a joke, or they tend to gossip around with your matters, and then they'll be making you a laughing stock. So it is very much important that you identify the relevant people, the good people that you can see and feel that you will trust, and then you can talk to and offload unto them or tell them. Even through calls, you can call somebody that you feel you can trust. You can call somebody and talk to somebody. You know what, I've experienced 1, 2, 3 today, and I'm not good at all. I feel like it's becoming a burden on me. So it is so heavy on my shoulders. I need just to offload. There are people out there who would love to listen, and that you may know as a person. With me, I know who to call when I have problems. I know who I can talk to. The people that I trust, I know that this one I can talk to, and then I can get well. And in the next morning or so, I'll try to call our EHW or our offices and then make an appointment to go and talk to a professional. And on the other side, the other problem that I think we need to also identify is that I think the accessibility of the EHW is not proper within our organization. It's something that I think our organization need to look at, because in my thinking, I believe that if we can have in each and every police station or in each and every unit, we have an office whereby there is a full-time social worker, a psychologist, as well as the one for spiritual, a chaplain. Yeah, if we can have those three people permanently so in each and every police station, police units, all those, we need to have such members there so that we can easily access them. Whenever I feel whenever I feel that I'm having a problem right there at my workplace, I know which door to go to at that moment. Because now when you're thinking that I need still to go drive and get into QD Arcade and go into which floor and stuff like that, it becomes a bit inconveniencing on the other side. So we just need to have them closer to us, whereby we can talk to them on a daily basis. So it will help a lot for most of us.
No, thank you very much, Constable Masilo. Sia, thank you very much for those insights.
Thank you.
That was psychologist Sia Zigalala, as well as Constable Masilo, sharing his experiences of what he's been through on the ground, and it helps us to understand how important mental health is. After the break, we talk to Polmed and see what they have to offer in terms of our members going to seek help. Don't go away. And welcome back to this session where we are talking about mental health. We've had a discussion previously with the external psychologist. We've spoken to our EHW component head, General Temba. We've spoken to an operational member. Right now, we've invited Polmed into the studio to talk to us about what they offer in terms of the services that we can expect from Polmed. In studio, we've got Dr. Malebu Majatlad. Welcome.
Thank you so much, Brigadier.
So maybe let's talk about Polmed and its offering. We were talking about mental health, and the first question is always about how much does this cost me if I were to go outside of services that are offered in the organization? What do you offer in terms of mental health awareness as well as the products?
As Polmed, we appreciate that mental health is a big challenging concern in the SAPS environment. We have therefore developed and embedded in our product offering multiple points of care that members and their beneficiaries can utilize in addressing any identified and diagnosed mental health conditions. To provide better clarity on that, we have chronic medicine benefits where members, once they've been diagnosed by a professional, can gain access to our list of drugs, which we call a formulary, that the scheme pays at no additional cost to the member. And we do not limit the RAND value that we pay for that medication. We also provide out-of-hospital services. If a member needs to see a psychologist, a psychiatrist, or a counselor, we also provide those services to the member at no additional cost, and it does not impact their day-to-day out-of-hospital benefits. And where it is necessary for a member to be admitted to a facility, we also provide benefits that cover for, at a minimum, 21 days in hospital service. And if there's a need for additional days, we also will approve that on a day-to-day and case-by-case basis. So that is but just an overview of the benefits that we provide for mental health conditions.
So maybe just to zoom in specifically to some of the specialized areas. So when you say you provide this cover, would it mean psychologists, psychiatrists, social workers, or any other person dealing in mental health? What are the specialized services that you are talking about when you say you provide that support?
Okay. So we have a network of mental health providers that have a national footprint, and these providers are specially trained to deal with mental health conditions. So we initially have counselors, and we have psychologists, psychiatrists, and we will always involve the general practitioner, who is the gatekeeper to members accessing a lot of services. So we have this network of providers out in the market that engage with our members. But internally, we have psychiatry nurses that engage with our members, those that we've identified as having a chronic condition, chronic mental health condition, and are registered on our program. We then allocate specialized nurses that then contact and follow up with the member, ensuring member is taking their medication, member is seeing their counselor or their doctor, and also checking on the family unit as a whole, because we do not think that the member exists in isolation. There is a family behind every member, so we ensure that we provide holistic care to that member and the family.
And while you're talking about that holistic care, we recognize that mental health it's a long-term process. It's not a once-off where you go and see somebody, they prescribe something. You might need to be on a long-term psychotherapeutic process with the service provider. Do you cover such chronic and long-term support? For example, if I had depression that requires me medication for minimum 6 months, would you be able to cover that?
We definitely cover that. So I'll start off by firstly saying the conditions that we cover. We cover for depression, we cover bipolar, we cover schizophrenia, we cover post-traumatic stress disorder. So each individual is unique as to the period of time that they will have the condition and require support and care. So we do not upfront limit care to 6 months. It is up to that individual's journey and process in engaging with their healthcare providers and so forth, that we will then determine how long we're providing care. So there's definitely not a cutoff date to say 6 months or 6 weeks, that's how long. We walk the journey with you as Polmed, and we are there for you as long as you require us.
And I think there's an appreciation that our job is one that is very stressful. And so that's why we are talking about mental health awareness, especially now in October. How does Polmed include beneficiaries as well as other extended family members that might need the same support that maybe I as a member are seeking from service providers in terms of coverage for both the marine as well as the other option?
So on the marine and aquarium option, we provide the same mental health benefits. So what I've spoken about in terms of the benefits and the programs that we have, it is available to all members on both options. The benefits we provide are also extended to the beneficiaries. So if there is a beneficiary at home who has a mental health diagnosis, we also provide the same level of care. We have case managers who will follow up with that beneficiary. We approve the chronic medication, and we also do the whole psychosocial management of the individual at home. As I initially said, if a SAPS member has a diagnosis and they're enrolled on the program, we take the whole family on that journey of health. And so is the same where a beneficiary has that diagnosis. We provide those same scope of services and benefits to the beneficiaries as well. And I'll want to expand and give an example. If a SAPS member has a diagnosis of depression, and at home it's challenging dealing with someone in the home with that diagnosis, that in itself can end up with other family members also developing mental health conditions. We will also onboard them and treat the whole family together, and rather than doing an isolated type of approach in managing and helping the member to get the care that they need. I think also I want to talk about when we speak about the holistic management, when SAPS members are exposed to a traumatic event as a group, we have what we call debriefing sessions or debriefing benefits. Each SAPS member is afforded 4 debriefing sessions per year. And these sessions are paid from what we call the risk benefit. So they don't touch the member's day-to-day benefits. And where the member has required individual debriefing, we provide that. Or where the event has occurred with multiple SAPS members involved, we can also offer group debriefing services. So we encourage SAPS members, if they ever do require that service, to please engage with us. We do provide it, and it is at no extra cost to them.
And how do you go about talking about these services with many of our members? As you know, we've got about 180,000 of our members. Some of them obviously are not on Polmed, but the majority of them that are operational are. How do you talk about some of the upcoming initiatives in terms of awareness drives, whether it's for mental health or for any other services that you are offering as Polmed?
Okay. So we have a multi-pronged approach. I will start off with the wellness weeks. As a scheme, we embark on wellness weeks in the various provinces where we spend a whole week dedicated to communicating, empowering, educating members about the wellness services that we provide. And it is at that point where we even identify some of the members that do have a mental health condition, and we refer them to the appropriate program and educate them on the benefits. We also have the scheme website where information about the diagnosis and management, and just to better understand what it is, depression is, or bipolar or PTSD. We provide that member communication on the website. We also have a newsletter that we distribute on a quarterly basis that again speaks to the mental health conditions and the benefits that the members do have. As a scheme, we have obviously our annual benefit guide. We encourage our members to read that benefit guide and better understand what it is that they are entitled to. We hear members being cautious about how they utilize their benefits with the fear that they would be depleted at a certain point. But with regards to mental health, the way the product has been designed, we do not touch the members day to day. The key is that the members must register on the program. We will cover your chronic medications with no limits, no co-payments. We will cover your hospital admission and even your out-of-hospital consultations. We cover all those services.
Yeah, it seems like there's quite a broad coverage in terms of mental health, and I like the fact that you are saying you're not just going to drop them as soon as those funds are depleted, because you have tapped into those savings, which is very important. I think just in wrapping up the discussion, what is it that we can do as members, or how do you normally collect feedback from us to improve on your service offering in terms of the products that you offer to us?
As a scheme, we are always wanting to be receptive to the members' needs. And as a result, we do conduct a member survey twice a year. We encourage members, when they do engage with us and they find out about the survey, to please provide that feedback to us. When we do the wellness weeks as well, that is another opportunity that members can then engage with us to tell us about the product, whether it is working for them, and how we can better improve it. Also, when members engage with the case managers who call them, whether on a weekly basis or monthly basis, that in itself is also another opportunity to talk to us and tell us how we can better improve the product. But as Polmed, we are always conscious of the fact that more can be done. So we are continuously looking at opportunities of developing additional mental health services and benefits that speak to the members' needs, that are easily accessible, but also that generate the health outcomes that we're seeking to ensure that members are mentally and physically well at the end of the process.
Dr. Mane, thank you so much for making the time. That has
Only a
been
pleasure.
very insightful for you to come and share your insights as Polmed.
Thank you very much for the invitation, Brigadier.
There you have it. That's our discussion for the day. Mental health awareness. As you know, October is mental health. So that was a discussion we bring into you to make awareness and to bring to the fore issues that relates to mental health. And as we are always saying, you are never alone. There's always help out there. Please do reach out to all our EHW offices when and if you need to do so. Until next time, goodbye.